I think it's unethical for a healthcare professional not to get vaccinated.
I feel like this is unethical, for an employer to force an experimental vaccine, and if, they don't receive it, they get fired.
I loved working at Methodist. Like the whole time I was there prior to this whole vaccine situation, it was a very good company to work for. They were one of the first ones in the whole area, I think even part of the nation, that got the vaccine at first at the end of last year. And then they're definitely the first ones in the nation to make it mandatory.
When the vaccines arrived, it was like a big party here. I mean, people were excited, and I'd say most were rushing to the vaccine, but many in the middle who were like, well, let someone else go. Let me see someone else first. And so on December 31st of last year, we put a bonus in place, and we called it a hope bonus. It had a catch though, and that catch was you'll have to be vaccinated to receive it. And in fact, by the end of March, we were at 84% of people were vaccinated.
So a lot of us found that very peculiar, because why would you pay someone? I mean, there's over 26,000 employees. Why would you spend that much money just to get, people to take this vaccine?
The vaccines were widely available. They'd been used in, well over 100 million people safely at that point in time. And we were still in a pandemic, and we needed to prevent harm to our patients and keep them safe. And so we ended up mandating this and announcing this at the end of March. And here we are now in June, and it is in effect. And we have some people, unfortunately, who are suspended as a result of this. But the vast majority, 99.2% of our people, are vaccinated now.
After the last email from Mr. Boom stating how the unvaccinated people who are not getting this COVID shot is not protecting their patients, I sent a letter to my supervisor and resigned that day. I had one more day before I was going to be suspended to work there, and I could not work another day. Could not.
From the get-go, I said, if it comes down to my job or this vaccine, I will lose my job. I just don't want to inject this thing into my body that I don't even know what it's going to do.
I do not consider myself an anti-vaxxer at all. I believe in the vaccines. In, say, 4 to 5 years down the road, that it has been proven that you really should be getting these vaccines to help you. I'll be glad to take it.
I'm refusing the vaccine because I'm genuinely, worried about the reactions or even long-term effects.
Last year we were looked at as quote unquote superheroes, and now this year we're being kicked to the curb for absolutely no reason except valuing our own morals, and rights basically. So I want Methodists to be held accountable for their actions. I started the online petition and started contacting the media to try to get some kind of resolution, but nothing I did worked, and they just didn't care. So then that's when I contacted a lawyer, and I started creating this big mass action lawsuit. I've already had COVID. I even had a doctor tell me, well, it'll keep you from dying. It'll help you with the symptoms. But I didn't die the first time. And are they 100% sure that I'm not going to die from that shot? Absolutely not. Since I've already had it, and I know my case was so mild, when you weigh out the risks versus the benefits, it just doesn't add up.
On July 23rd, I could not breathe. They took me in an ambulance, and they took one look at my husband, and they called another ambulance, intubated twice, ECMO, in a coma for 6 weeks, and a trach. So I can't talk, can't move, can't do anything. When I come to, I'm informed that my husband passed away. They recorded his heartbeat. And so that is the last thing I had. My very first vaccine, it was very emotional for me, because I couldn't help but think, gosh, if this had only been available in July, I wouldn't be a young widow. I wouldn't have severe deficiency in my legs. I wouldn't have to sleep with oxygen. In all, it was 100 days in the hospital. I didn't come home until the beginning of November just in time for my birthday and our 15-year anniversary.
We all have our opinions, but we live in a free country and we have the right to choose.
I respect their right not to get it. However, when it comes to patient and their safety, we owe it to our patients that we don't give them something.
We have a sacred obligation to put our patients first. And part of putting our patients first is getting vaccinated. I think that a lot of hospitals are taking a wait and see approach. They want to see what happens with us because, you've already seen we have lawsuits against us, and it's a risk.
We expected from the conversations we were having with colleagues around the country and locally that many people would do this. In fact, ultimately everybody would do this because it's the right thing to do. We've shown that this can be done. I wish it was 100%. I wish we didn't have to have anybody leave the institution. But at the end of the day, we of course are not going to force anyone to be vaccinated. That's their choice. And if that's the choice they execute, and choose, we ultimately thank them for their service to the institution and to our patients. And we're sorry to see them leave, but we're not the right place for those individuals.
Hey, thanks for watching. If you like this video, check out these other videos from USA Today to stay up to date with all the latest news.